my name is Kate. I'll be your nurse today. What is your name?
No jaundice.
And do you know your birthday? I'm just going to double check in the wristband here. And then are you aware, do you have any allergies that you're aware of? I can also ask mom if there's any allergies or any allergies to medications.
Okay, I'm just gonna...
All right, and then are you in pain today? Can you rate that pain on a scale from 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt in your entire life? All right, I'm sorry about that. Well, we do have a medication order from the doctor, and this medication is Ketorolac, and Ketorolac is used for pain. And it's similar to like ibuprofen, Mom, but it is just a little stronger and it'll work faster and it'll go through your IV.
Symmetrical.
Okay? All right. And then do you have any questions, Mom, about the medication? All right. So it's commonly known as Toradol. And this medication, like I said, is an NSAID, so don't take it with any other NSAIDs like ibuprofen, Mom. Okay? And we don't want to be taking this more than 5 days, and also it can upset your stomach a little, so we want to make sure we're not taking it on an empty stomach.
Grasp reflex.
Okay? And just report any signs of like GI bleeding, if there's blood in the stool, Mom, or you notice anything, emesis, you just let us know, okay?
Perfect.
All right. And Bryce, what we're going to do is we're just going to put this medication through your IV. It just goes through this little tube. We're not poking you or anything. It'll be a quick, easy and done, and hopefully it'll make you feel better, okay? Do you have any questions for me? All right, well, we'll get started. So I would do hand hygiene. I would put on my gloves. And then I'm just making sure that I am like triple checking with the orders and the MAR from the doctor. And yes, we are doing Ketorolac, and I want to make sure I have the right patient, the right drug, the right dose, the right time, right route, which is IV, right reason, and right documentation. All right. So everything looks good here. Checking. Okay. And then it is important with pediatric patients that we are converting it to a safe dose. So I did convert to 0.58 milliliters for his weight, which is 17.3 kilograms. Okay. So I did convert that already. And we are going to get started here. Okay. So first I am going to assess the IV site, just make sure there's no signs of redness and everything's patent. So I'm going to
sounds like it's like a patent is like a patent pending, like
scrub the hood.
Mom said the last speed was 2 hours ago, and that's
I'm going to flush here. All right, everything looks good.
Baby's ankle, and baby has their ID band.
Now I'm going to clamp.
On their back, but nothing else in the crib. There's a whole syringe in the crib. I'm gonna miss a lot.
Keep this paint. So. All right. Now I am going to. We're going to use 3 milliliters of diluent. So I'm just going to, this would be full, and then
But you missed 3 things?
I'm going to waste.
No, I missed 3 things.
Till I get to 3 milliliters.
But if you miss like something with
all right,
then you're not going to miss the whole.
I want to make sure there's no air bubbles.
Okay. No, it's not. Hey Mom, I'm gonna do a quick assessment on baby. I would come in.
Now I am going to pull up 0.58 in a 1 milliliter syringe.
What? The Yeah, it'd be really better for
and making sure we have the right medication
I don't know where I
and the
was at.
right
Try to
dose.
see, like, the bell. Yeah, you can listen to. Thank you. You're
Alright, and that
actually-
is
Part off that.
our
You're not.
30 milligrams in
Also, you might want to assess
2
for
milliliters.
recovery and skin tone before you do that because baby's gonna start crying.
Right.
And the more I read.
And I'm pulling back 0.58, and I'm just making sure there's no air bubbles.
Let's start over.
Alright.
Hey, my name's Natalie. I'm gonna be your nurse today. I'm coming in just to do a
Alright,
quick
so
newborn
pulling
assessment.
that back.
Alright. Could you verify the baby's
Making
name and
sure
birth?
no air bubbles.
Okay,
Perfect.
That
All
seems
right.
to be accurate with what we
And
have
now
in
I'm
the
going
baby
to
first
add
scan.
this
Alright.
to the
I'm just
diluent.
gonna do a quick. Oh no, I shouldn't do that yet because the baby's gonna start crying. I'm just
I
gonna
would
assess
pull
for
this
breathing really
back.
quickly.
Insert.
Baby is startled. Bye.
Alright.
I would hopefully
And then
have
I would put
access
this in
to
my sharps container.
appropriately sized.
And then I'm just going to get all the air out of here.
For a full minute. I'm also going to be listening for any murmurs. And then I would listen for another
Alright.
full minute for respirations.
Okay.
I would be listening for any irregular
R.
breathing patterns, apnea. Great.
Okay,
I'm also
so we have our medication. And then I'm just going to scrub.
Perfect. At this time, I'm also going to take the temperature under, take the axillary temperature. Great. Fever. Okay, we're going to assess baby's color. Good.
Scrub
There are no
here.
signs that I'm seeing of any birthmarks, no Mongolian spots. I'm going to check Catherine's bell.
Alright, so we have our tubing.
Bell is good. Okay, perfect.
Okay.
I'm gonna assess
Now I am going to connect this to the syringe pump. Alright, if you guys have any questions during this procedure, you just let me know, okay?
I hit all of like the movements.
So,
Like, I think it was
just putting up my syringe.
Glucose in the mouth. Noise.
I mean, I literally hit it.
Loading.
The beginning was so awkward. I was so tired.
I'm gonna do the slides. I was like, President equal on both sides.
Alright,
Baby's moving both.
now I am going to connect this
equally.
while I turn this on.
Grasp reflex is equal. And both fingers and toes. Toes down there. Yes, I did. Toes and plant. This spread. Planter grass. Palmer and planter. Babinski. I know spread, but there's also planter. Is there really? Yeah. I think I'm being helpful.
Alright,
No, you are.
we're gonna make sure that everything is
Brachial
clamped.
pulses, femoral pulses are present.
Okay, so new patient,
Check
peds.
for Babinski reflex, that is present. And then the next thing that I'm gonna do
Select, and we're doing this in
is
10 milliliter.
ask if the baby has
Syringe.
had a bowel movement yet. They have. Oh, that's awesome. That's perfect.
The drug is Ketorolac,
What was the last
and
time
he's
you
under
breastfed?
60 kilograms.
You were over here last time.
And we got 30 milligrams in 2
Jar scale?
milliliters.
Okay, that matches what we have in the chart. Awesome. I'm really
And the
glad.
drug amount is
The next thing that I'm gonna do
8.65.
is flip the baby over.
Diluent volume
I don't
is going
remember
to be
what came And the baby's
3.58,
spine is.
and the patient
line.
weight is
And there's no
17.3.
different I'm gonna assess baby vaginal
And then
area.
the dose would be
And
0.5 milligrams per kilogram, which is a safe dose range for a pediatric patient. And then I am just double checking again in my MAR that this is the correct order, correct everything. Alright, everything looks good.
I might just verbalize the last word.
So I'm going to press
I
next,
said there's no dimpling.
and I'm going to push it over 5 minutes.
So
I'm going to clamp,
breast
make sure this is unclamped,
Oh yeah, like when you take your
to start.
stepping reflex.
Just making sure that this is going through the line.
Baby is stepping.
Alright, if you guys have any other questions, you let me know. And just hit
I'll
this
save it, I'll
button,
check.
this red button for your call light if you need anything, okay?
I'm really at a loss, like I feel so
Alright.
uncomfortable.
You did a lot.
Bye. I hope you feel better. We'll come back and reassess your pain in a little bit,
'Cause it
okay?
feels like I did nothing.
No, you did
Awesome.
most
Yeah.
of the things actually. You did vitals, you did skin.